Well, good afternoon. After 10 months of being ravaged by the COVID vaccine, we are finally fighting back. Tomorrow, the first city employees will be getting their COVID vaccine. We will have 30 employees at the health department, the folks who will then go out and offer vaccinations to others. And we're going to start tomorrow with the 1,200 medical first responders and EMTs that work for the Detroit Fire Department. And so they will be in the first phase. That's this coming week. Next week, our health department will offer vaccines to this city's 450 home health care workers. So the people who go into homes for those who are disabled, can't get out, provide care for our most vulnerable. We will be offering vaccines to all those home health care workers next week. And then in January, most of the nursing homes in this city have a relationship with a pharmacy that will be providing the vaccines, but those that don't, the Detroit Health Department will be in and will vaccinate the residents and staff at nursing homes the week after next. That is going to be the plan. To our city employees, and I've had many, many conversations, well, I would say to the members of our health department and our fire department, while I believe this is the right thing to do, we are not going to mandate that you do it. It's going to be your choice. Nobody's going to be disciplined or punished for that choice. But the reason that we all want to be here is we are going to lead by a positive example. And probably like most of you, do I take the vaccine as a topic of conversation all the time, and talk to a lot of folks in this town. We can't have a conversation about whether to take a vaccine from the federal government without acknowledging the history of racism that we have had in the healthcare system. The Tuskegee experiment wasn't done by some private lab. It was conducted by the U.S. Public Health Service and the CDC. It wasn't ancient history. The Tuskegee experiments ran until the 1970s. And the federal government made an absolutely shameful decision to tell poor African Americans they were being treated for syphilis when they weren't, in order to look at the symptoms. And it wasn't until 1997 that a president finally acknowledged it and spoke out and apologized for this despicable period in our history, when Bill Clinton did it. So this is something very much in the consciousness of many Detroiters. And so when they see the CDC and the federal government saying we have a vaccine, there is a higher level of distrust than you would expect. And we also have, while many of the concerns are long-standing and deep-seated, others are far more recent. It seems like every day on the internet there's a new theory that they're injecting us with nanobots so the government can track us and the like. And so I keep finding that these conversations, as I have them and I say, you know, this is really important. And when I say that to people, here's what the first thing they say to me. Okay, are you going to take it first? And you get to a point where you realize words don't matter. Actions matter. So I'm going to take the first vaccine shot today, along with the other leaders in this community who are here, for this reason. This COVID virus is not going to go away by itself. We have to fight it with this vaccine. We're a year into it now, and the only reason it started to taper off in Michigan in the last few weeks is because the governor put in a number of other shutdowns. We are going to be having year in and year out our school children at home. We're going to have our restaurants closed. We're going to have our neighbors out of work. We're going to have to be worried that our parents and our grandparents are going to be at risk of dying from this disease until we fight back with a vaccine. So I know what the literature on this is. I've read everything about it. Dr. Dunn will correct anything I say that's medically not quite correct, but in years of running a hospital system, I learned roughly the principles of healthcare, but here's what I know, is after I get the vaccine today, it's possible I'm going to have a sore arm, it's possible I'm going to have a little bit of a fever, it's possible I'm going to have some chills in the coming days. Those things are possible. That means your body's working. Your body is building up the germ-fighting tools to fight off the infection if you get it. And the question is, do you want your body to fight off, to build these germ-fighting tools now when you're healthy, or do you want to wait till you're on a ventilator struggling for life and then hope your body manufactures those tools? And so I believe I'm making an informed decision, but I was not going to ask the men and women of the health department or the fire department to say, I think this is the right thing for you, for your families, without being willing to do it myself. And when I said that to Dr. Dunn, who has been the longtime medical director for the fire department, he said, I'm the one who's been telling the men and women of the fire department this is the right thing. I think I should stand up and lead. He's a emergency room doctor. He'd be on the list anyway, but he said, I want to stand up and lead so that nobody has any doubt. And when Denise Fair said, I've got my 30 healthcare workers getting their vaccines tomorrow, I don't want them to have any doubt. I want to stand up and lead. When I talked to Wright Lassiter at the Henry Ford Health System, he said the same thing. I don't want to mandate my employees to do anything. I want to lead by a positive example. And Audrey Gregory, the head of DMC, Dr. Gregory, is the leader of all of us. She got her shot on Friday, and she's going to talk to you about what she's experienced and what's happening there. The city employees are getting their shots through a partnership with the Henry Ford Health System, which has these very cold storage facilities and is getting us ramped up. And we are going to continue. We're starting on these numbers as they come in. I do expect us in the coming months to be running huge vaccination operations out of the TCF parking structure, but that's 3 or 4 months down the road. Right now, we need to get our first responders to do it. We need the first responders to trust this decision enough to know that they, their families, and the city will be better off if we take the vaccine. And so I'm pretty much done with words. We're going to show you that we believe it. And with that, I'll turn it over to the outstanding CEO of the Henry Ford Health System, Wright Lassiter.
Thanks, Mayor Duggan. It's good to be with you and other leaders here today. I think we all know that this has been a complex journey and will continue to be a complex journey for all of us. But we're sitting here today because we are committed to building trust and confidence in our communities through our collective preparedness, our transparency, and our ongoing education. And part of that involves events like this event that bring leaders together with a shared message about safety and protecting those at highest risk for exposure and those who are most vulnerable to the severe effects of COVID-19. We're also here today as leaders, as you heard from the mayor, to demonstrate our belief in and our commitment to this vaccine campaign, which we believe is critically important and a major step forward and a significant milestone in fighting this pandemic. At Henry Ford, we joined health systems around the state and around the country in launching our vaccination campaign, prioritizing frontline healthcare workers who are directly involved in the care of COVID-19 patients within our healthcare system. And we received our first shipment the morning of last Thursday, December 17th, and at all 5 of our hospitals in Southeast Michigan and Central Michigan. And we began administering the first doses of the Pfizer vaccine within hours of receipt of that. As of this morning, we have vaccinated over 4,000 of our team members and continue to work diligently to ensure that all of our healthcare workers who are providing critical care to our communities receive the vaccine if they so desire. Part of our mission has been not only to offer our team members, but also to make sure that they have the information they need to make informed decisions. The mayor talked a bit about the concern and the potential trust issues that exist in communities like Detroit, communities of color. He referenced what happened some decades ago in Tuskegee with an experiment that created some of that. I sit here today to tell you that I was born in Tuskegee, Alabama, and so I'm really familiar with issues in that community and with issues of trust and distrust in the African American community for issues like this. And one of the reasons I'm here is to, one, serve as an example for the 33,000 plus team members at Henry Ford, but also to serve as an example to African Americans in our state, in this region and in this city, and to let them know that I feel very confident in both the safety and efficacy of this vaccine. We're pleased to be partnered with the City of Detroit to support our frontline essential workers, EMS workers, firefighters, et cetera. We're pleased to make resources available to the communities that we serve as well, particularly to help our EMS and first responders here in Detroit with their first vaccine. We take the partnership in this effort very seriously and are committed to helping those on the front line with this great city to navigate this complex journey that we're all in. Our Henry Ford team is ready to answer questions, and we also have multiple resources on our website at henryford.com to assist folks in the community. We know this is a complex decision for a lot of people, with biggest questions still being around safety and the pace of vaccine development. As I think many of you know, Henry Ford participated in 2 COVID-19 clinical trials, including Moderna. And we did that very specifically because we wanted to ensure there was access to a broad, diverse community who were participating in the clinical trials, so we'd have as much data available as possible to support decision-making going forward. We are confident in the data from these trials as it relates to both effectiveness and safety. We're just as confident in the FDA's strict approval process. The production of this vaccine was thankfully expedited given the ongoing pandemic, and now it allows us the opportunity to reach a major milestone in the fight. We encourage everyone to take advantage of the resources that are available and to make an informed choice, and we encourage individuals to get vaccinated to help us in the fight against the coronavirus. While vaccine distribution, we know, is an essential part of the COVID-19 response, other efforts like wearing masks, social distancing, avoiding large gatherings, and practicing hand hygiene are still critically important and essential even after one receives a vaccine. We just remind you that safety is everyone's responsibility. And again, we're very pleased, Mayor, to be here with you. Thank you.
All right. Thank you, Wright. And I think I have not always been a fan of how DMC operated since I left. Some of it has been well documented in the media, but since Dr. Audrey Gregory has gotten there, we have just seen a dramatic improvement. We've got great leadership there now. She stepped up just after she'd gotten here to help us do the original testing at the fairgrounds along with Henry Ford and in Trinity. And I'm just so pleased at what she's doing. And she's going to get a chance because she said, as much as I'd like to wait for your news conference, I'm going to lead by example and get the shot the first day at DMC. She did that last Friday, and asked Dr. Gregory to talk about her experience.
So good afternoon, everyone. I always love the fact when we have a collective objective, and I won't repeat the things that Wright has said, but what I will say, not just on behalf of the DMC, I think for me, I think through the fact that I am a Black woman. I think through the fact that I am a nurse. I think through the fact that I am a mom. And I have to add that I think through the fact that I'm a wife, or I will be homeless today. So I think through those facts when I make decisions. And so when I looked at our colleagues at the DMC, I think it's important as leaders that we lead by example. And so that was my experience on Friday. So like Wright at Henry Ford at the Detroit Medical Center, we received our vaccine on Thursday, and then we were live and ready to go. The anticipation was extremely high, and I made the mistake of rounding in the area. and they're like, Dr. Gregory, you're here, get your shot. And so as someone who has encouraged the team and in fact encouraged the community, I was able to sit in the injection chair with confidence, having read the science, having looked at the data, having listened to the professionals around me or physicians at Detroit Medical Center are very committed to the science. And so in terms of the experience, it was no different than getting my flu shot. The nurse was extremely skilled. I didn't feel anything, so for Wright and Mayor Duggan, it's gonna be okay today. In terms of, so I'm 4 days in, and in terms of side effects, I had a bit of a soreness of my arm on Friday night, going into early hours of Saturday morning. When I got up on Saturday morning, I was able to move my arm around, and 4 days later, I'm great. I was great on Saturday. I am great now. For over 1,500 team members and providers who have received the vaccine, we have not had any adverse reactions at this point outside of the soreness that we all feel. And so I know in our community, and not, I think specifically in our Black community, though I recognize among my team members that there's concern in all communities. But I ask us to not just trust the science, but to recognize that we're making decisions not just for ourselves, but for our family and our entire community. It is, the COVID-19 vaccine is one more thing in our toolkit. So in our toolkit so far, we have physical distancing, we have frequent hand washing, we have the wearing of our masks properly covering our nose and our mouth, and this is another tool in our toolkit. I understand fatigue. I understand skepticism. I understand cynicism. We talk a lot about the Tuskegee experiment. This weekend I had the opportunity to talk with my brother, and we were talking about Henrietta Ling and the impact that her life has had on research and how we were not always forthcoming, we were not always transparent. And what I liked about Pfizer and Moderna in terms of the approval process is the fact that our federal government invited other scientists in, right? So this wasn't just the FDA, but other scientists were also involved. And so I think as a country and as a community, this is one of those times that our collective common good is so much better when we do it together. So I know it takes a lot, and I know it takes courage, and I know it takes, particularly in our Black community, getting over the realness of things that happen. This is not imagined fear, this is not imagined skepticism, but they're deeply rooted in reality. So my ask of all of us today, the same ask I make of the DMC, is to simply trust the science and recognize that this is another tool in our toolkit. Thank you. Back to you, Mayor Duggan.
Thank you, Dr. Gregory. And since COVID first hit in March, Dr. Rob Dunn, the medical director for the fire department and the police department, who has, for all practical purposes, become the medical director for all city employees, has been going day and night to protect every one of us. And Dr. Dunn is coordinating now at the Walter P. Harris Training Center, the vaccinations being done in partnership with Henry Ford tomorrow, starting tomorrow morning. With that, I'll turn it over to Dr. Dunn.
Thanks. As the medical director for a long time of the fire department, I've always felt it's my personal responsibility to promote health and safety, and that's really a key part, of course, of any fire department. Since COVID, that's taken on a whole new challenge. What we have seen with COVID, what's happened in our community is unprecedented. And I've had the opportunity to help manage our response, to help manage our quarantine and isolation. And there have been, as everyone here knows, a lot of sadness and frustration as this process has gone on. At my core, I'm an ER doc who's committed to the pre-hospital care that we provide and have done work in EMS for decades. And when this vaccine became available, I reached out to the mayor and said, look, when I get my dose, I want to get it publicly. I want to be able to tell people that this is safe and effective. I want the people that I care about and work with in the fire department to see me get it and understand what's behind all the work on this vaccine. And I'm not going to repeat the things that have been said because they're very accurate and make good sense. But I just want to make a personal appeal that we all care about each other's health and safety, and one of the most important steps that we can take is getting vaccinated. And we know that vaccines have been the key for controlling a lot of diseases, and it's going to be the key to controlling COVID. So when you have the opportunity, please get vaccinated. The vaccine's the next step in our fight. It doesn't end the fight right now. We still need to do all the important things, just like hopefully we've never stopped washing our hands. Hopefully people are washing their hands a lot more now than ever. But it is so important for controlling this pandemic and moving us forward. And as the vaccine becomes more and more available, take advantage of it. Don't let an opportunity go by if you can get the vaccine now.
All right, and the City of Detroit's great health director, Denise Fair.
Thank you, Mayor Duggan. So as the Chief Public Health Officer for the Detroit Health Department, I'm responsible for protecting the health and well-being of the residents of Detroit. But also, I'm responsible for my team that I lead, and I take my role very seriously. So tomorrow, my staff will be getting their vaccine, and I just didn't want anyone to have any doubt about the safety of the vaccine or my commitment. So today, I stand with my staff. I'm taking the vaccine, and it'll be public because I believe that it is a critical tool to help keep us protected. And I also believe that leaders lead by example. So I'm encouraging my 30 staff of vaccinators to get their vaccine on tomorrow. And then the following week, the health department staff will be out with the home health workers so that the workers who are taking care of you in your homes will also be vaccinated. And they'll do this by the end of December. Now, there is going to be a period of a couple of months before the vaccine is available to the general public, but in the meantime, I urge everyone to learn as much as you can about the COVID-19 vaccine so you can make the best decision, the most informed decision for yourself as well as your family. You can visit the health department website at detroitmi.gov/health to find out more information. And also, please continue to do what you've been doing for the last several months to protect yourself from this pandemic by, of course, wearing your mask, washing your hands, and practicing social distancing, avoiding large crowds. Stay home if you are sick and seek medical attention if your symptoms worsen. And finally, if you do have a confirmed case of COVID-19, reach out to those whom you may have been in close contact with and let them know because it is the right thing to do. And with that, I'll turn it back over to the mayor.
All right, with that, we'll take any questions.
Hi, everyone. John Hewitt from WWJ. Thank you for the opportunity. I just had a few. I'm curious if it's, and I can follow up later if need be, but is there a numeric number of doses that you're able to identify as for Moderna that you have in stock ready to vaccinate people with, and/or Pfizer that you presently have?
We're working with Henry Ford, so right, you could maybe take that.
Roughly.
Yeah, so last week when we got our initial allocation, we got 975 doses per hospital. So that's, just under 5,000 doses. We're slated to get approximately 1,200 on behalf of the city.
This is Pfizer you're talking about?
The first was Pfizer.
Okay.
The 1,200, I believe, is Moderna on behalf of the city. And then we are slated to receive another 13,000 from Moderna that should be coming in the next day or so. Could be here, could be arriving as we speak, but yeah.
Thank you.
You're welcome.
Mayor, I know up front back in March, you were very proactive in regarding reaching out on your own for testing capability. I'm curious, after seeing what the governor said this week about vaccine distribution availability, I asked the folks in Oakland County this question. They mentioned they're getting their edicts from the state. I'm just interested if you have any insight in regard to whether there is a lag on vaccines being distributed, not to point fingers, but what you're seeing.
Again, I mean, this, it isn't doing good to keep going over it. When Donald Trump said we're not a shipping clerk, I stopped worrying about the federal government. I went out and got test kits and PPE on my own because I realized they were never going to deliver. Unfortunately, on the vaccine, the federal government owns all the vaccine. And so literally, they have to distribute to the state. The state then distributes to the hospitals, to the counties, et cetera. And so in this case, I don't have the ability to take a van up to Kalamazoo and haul it away, or I would. So it is very frustrating. The numbers continue to shift on us. And I know that on January 20th, we'll have a change of administration. Jeff Zients, who is going to be in charge of the distribution, I know well, is just a phenomenal public servant. I'm very confident we'll be told the truth and get prompt deliveries after that. Up until then, we're going to, all of us, going to vaccinate based on what shows up every day. And are you guys even sure from one day to the next what you're getting?
You know, I mean, unfortunately, the way it works is that we're told that every week we get a notice of what our allocation is. And so it gives us a little bit of an ability to plan ahead, but not a large amount to plan ahead. And so, you know, it's a bit of a logistics Rubik's Cube for us.
Appreciating this next question, maybe we don't know yet, but when we read about mutations of this virus, I'm curious the opinions of anyone here in regard to how effective this may be and whether that creates a concern moving forward about the effectiveness of what we're now using as the vaccine, or you know, how that may play, if at all, into what we're doing.
Sure, and there's been a lot of discussion on this topic as people have seen the headlines about some of the mutations. And so far, one thing we understand is that all viruses mutate. Common cold viruses, all the viruses that we've all experienced as causing illness over the years. And that so far, it looks as though the vaccines are providing protection based on how they were developed, and that a lot of mutations aren't going to affect that. But no one really knows what the future holds, and it could well be, just like we get a newly formulated flu vaccine every year or every couple years, depending on what's happening in the community, that something like that may need to happen for this. And that's why there's ongoing research keeping very close track of the virus. Our own state lab does genetic typing on the virus samples that we send them, and that's the key. We don't give up the fight. We've got to stay focused on the science behind these viruses.
Thank you. The last one I have, Mayor, is back to those who choose maybe not to get vaccinated. You're setting the example. Some have, not to digress here, but some have looked at public officials who have opposed or downplayed the risk getting vaccinated as hypocritical. You all have pretty consistent with your messaging throughout. But when you talk about setting an example, I don't know if you've heard from a lot of folks who are frontliners that don't want it, or if you can elaborate or give a little more context into weighing into the decision of, obviously it's voluntary, but trying to encourage them, but yet respecting their personal choices.
You know, I've talked to a number of firefighters who have said, I know it's the right thing to do, but we're the very first. And that is a different level. And I had enough conversations to know that if I get the vaccine early, and all of us made the same decision, some people will criticize us for getting it early, but if I don't get it and it causes a number of other people not to get it and somebody gets sick and dies, that'll be a lot harder to live with. And so I just made the decision that I'm going to get criticized no matter what I do. If getting the vaccine early causes more of our employees and ultimately more Detroiters to get it, the criticism will be okay. And I don't know if Wright or Audrey want to talk about it, but they're making exactly the same decision at their places.
It is the same decision, but what we do in the interim, and I'm sure Wright is doing the same thing, for those who are resistant or concerned, we spend a lot of time educating. And we have various levels of staff, just some are immersed in the science, some are not. And so we spend a lot of our time educating. We do a lot of group education. I do a lot of one-on-one education, or medical staff. They spend a lot of time educating. And really it's about getting people comfortable around the science. Part of why it is not mandatory is for that reason. It's that people are still working through not just where their heads are, but also where their hearts are. It's so novel. and it's in its own novelty frightening. And so I encourage my team. I think what I say to my group of leaders that this is one of those times that there will be no vaccine bullying. And I think as leaders, it's important for us in this case, as always, but more importantly now, to lead with empathy and compassion, and to be a part of helping people to get educated around the science and what this all means.
So I certainly concur with what Audrey just said. And I would tell you that thus far, we have about an 80% acceptance rate within team members of Henry Ford. But I've talked with a number of frontline team members, some working in our corporate office, who said to me, Mr. Lassiter, I don't know about this vaccine. And I said, well, next Tuesday I'm going to get the vaccine with Mayor Duggan and several other leaders, and we think it's important to. And they said, you're going to get it? And I said, I'm going to get it, and I would tell you that it's safe. And so we are trying to communicate on various levels with our staff. We put out several versions of FAQs for people to understand it. We launched our own internal committee of scientists and researchers and ethicists to evaluate all the public data once it came out, as well as to establish policies for our team members. Similar to what you heard from Audrey, we are not mandating it, and we're also not bullying people to do it. And so our hope is that as they see more of their colleagues getting it, as there's more information out in the public, as you begin hearing about it from folks who don't look like us and don't do what we do, but folks in the church and folks in the community that can translate for people in ways that make them more comfortable. My sense is that we'll continue to get pretty strong uptake, particularly by those folks who are more inclined to be concerned early on.
Thank you.
Yeah.
Mayor, we have a few questions from reporters who are watching remotely. Sarah Rahal and Jamie Edmonds from, Sarah Rahal from the Detroit News and Jamie Edmonds from Channel 4 both wanted to know if they're clear that the vaccine is not being mandated today, but if there is not a lot of buy-in.
No, we have no intention of mandating. I don't think the vaccine should be mandated, and the city of Detroit certainly will not be mandating vaccine. I can't imagine anybody else will either.
We will not.
And if there is a low participation, how do you expect that you would get those numbers up?
So the thought of failure doesn't really cross our minds. So we're starting with this. This is our step, and I'm hoping that leading by example will drive this. And, our health workers have seen what COVID has done to this community. A lot of folks in this town lost family members, and we all remember that drive through Belle Isle when it really hit us the magnitude. So I think people know what's at stake, and we're approaching this positively. As Dr. Gregory said, we're approaching it with empathy, understanding. Our firefighters, when they come in tomorrow, will have Henry Ford medical staff taking them through the science behind this and helping them make informed decisions. Nobody's going to be bullied, but you're going to have positive messages. I think positive messages will win out. That's what I believe.
Okay. One quick follow-up from Sarah. Not sure if it was mentioned how many Moderna doses the city received?
Received 2,000.
2,000? Okay. One cleanup question from previous briefings is business enforcement on COVID safety requirements, and wanted to know if where we're at on numbers right now, and if those businesses' names will be made public at some point.
I promised the last briefing that we would go back and look at that. I thought it was a reasonable request that we make the enforcement public, and our Director Fair can tell you exactly what we're doing so everybody can see what the enforcement's been.
Sure. We are continuing to enforce. My teams are spending a lot of time on the weekend, throughout the week, following up on all the investigations. And so about 30 days ago, the mayor and I announced a call-in line for residents to report violators. And we have heard. We've heard from our residents. We've had over 400 complaints, and that has resulted in multiple tickets. It's available right now on our website on the COVID-19 dashboard. It lists all of the businesses over the last 30 days that have had tickets or closures. We want to be transparent in this process while also holding the owners accountable.
So you can find it on our website now, all the information.
Great. One final question. This is from Eli Newman at WDET. He says, the Congress's coronavirus relief package includes $638 million to carry out a low-income household drinking water and wastewater emergency assistance program. Mayor, do you have any idea how that would be enacted in Detroit and if it helps with your 2022 shut-off?
So our team is looking at the details right now. There's that provision, there's a transit provision, there are vaccine distribution provisions, there are multiple provisions of the new CARES Act that will be affecting the city of Detroit, and I've got a team analyzing all of them right now, and we'll have more understanding of that in the next day or two, how much flows down to the city versus how much is administered by somebody else.
Okay. That's the last question, so we can
We'll go get our
transition
shots.
now to getting vaccinations.
All right.